According to the South China Morning Post, it was November the 17th, 2019 in Hubei province in China where the world's first ever coronavirus case was detected. According to the Chinese, it was a 55-year-old man who caught this deadly virus, and agar experts ki mane, this was originated through a bat. Ji haan. Hello, I am Resham and you're watching DNP India. Started in 2019, अब एक ऐसा टाइम आ गया है कि जब इस वायरस हैज टेकन अ डिफरेंट शेप ऑल टुगेदर एंड एट प्रेजेंट इट इज जस्ट अनकंट्रोलेबल, स्पेशली इन इंडिया वेयर इफ वी लुक एट द डेटा फ्रॉम लास्ट ईयर द सितंबर, जहां पर कंट्री वाज रिपोर्टिंग अबाउट 93,000 cases per day on an average in mid-September, which was the highest that time, but soon infections had steadily declined. As you can see, अगर इस ईयर की स्टार्टिंग के डेटा को देखा जाए तो during the mid-February, India was counting on an average of about 11,000 cases and like 9,121 cases on the 15th February, as we can see, and the daily deaths from the disease were actually below 100. Jahan the world was talking about our country back then in December and discussing to how we were succeeding in bending the COVID infection curve altogether. So there was an emergence of different strains coming in the world. There was the UK strain, the Brazil strain, the South African strain, and now India may be abhi tak we're aware of the double mutation strain, a strain जो India में ही form हुआ है. And according to experts like Rakesh Mishra, the first ever person to actually discover about the double mutation strain. So according to him, this was one mutation in India, and it is the combination of a strain which was found in California, USA, and the other is the Indian strain itself, which is actually turning out to be a super spreader, forming a creation of a third strain altogether, the mixture of the New York, the US, California and the Indian strain. And of course we can see how deadly it is now. So अगर हम recent data of the National Center of Disease Control NCDC तो के बारे में बात करें तो बहुत से पेशेंट में ये UK strain भी दिखा गया है. And so according to that, over 400 cases of the UK strain and 76 of the Indian double mutant were found in Delhi. And मैं आपको बता दूं that unlike the South African and the Brazilian strain, the UK strain is actually a super spreader. And सबसे पहले UK strain पंजाब में ही आया था. UK strain के cases सबसे ज़्यादा देखे गए हैं इंडिया में. So actually it's the UK strain and the Indian strain which are causing such a surge in the cases. So now talking about the world's reaction to the tsunami that our country is facing at present, and their reaction to the maximum number of cases coming in a day. Let's have a look.
In Delhi, a crisis deepens with hospitals completely overwhelmed and at a breaking point. Please come see my mother, this man pleads, but it's too late for her. Oxygen is in such short supply in many parts of the country, it's being shipped to hotspots like precious cargo, with many waiting in vain. This man says his wife couldn't breathe, but the hospital didn't have any oxygen to spare. By morning, she was dead. India's second wave is crippling the country, fueled by that double variant that may be more severe. With deaths hitting record highs, crematoriums are overrun. The grief raw for so many, and doctors are swamped.
So what will happen in the coming weeks? So I'm really afraid this time that it has gone out of control.
So bad, the capital is under lockdown. Shops and restaurants closed all week. India, once eager to export vaccines to other nations, now struggles to vaccinate its own population.
Lockdown se bachana hai.
Prime Minister Narendra Modi addressed the nation this week, calling on lockdowns to be used only as a last resort. But sharp criticism is being directed his way. He spent weeks attending packed election rallies
BJP Sarkar.
as voters crowded in tight spaces to cast their ballots for the staggered election. And officials did little to curb a massive religious festival that's been blamed for super spreading the virus. India, lulled by extremely low case counts earlier this year, opened up and relaxed measures. Now it's reeling like never before.
We're still learning a lot about it. One of the particular concerns is that we've seen these mutations previously separately, but never together within the same virus. And both these mutations contribute substantially towards potential risk of causing both more frequent disease as well as potentially causing disease in people who've previously been immune, either from recovering from natural infection or from vaccination. And the fact that we're seeing both of them together in one virus certainly makes us concerned that this really could have the potential to cause major problems, including what's been recently witnessed in India.
A report by CBC News, जहाँ पे आपने देखा कि how their doctors showed a great concern, but even their international media have pointed out कि कैसे everything in our country was taken so lightly, and बहुत पहले ही ये election rallies और ये spiritual gatherings पे रोक लगा देना चाहिए था. Where they're not just concerned about our country on the whole, but their own country as well. Like UK, जहाँ पे कुछ sample of the Indian strains have been found, and this led them to add India in the red travel list. Let's see their take on this whole issue. Have a look.
This is a variant that's been identified in India and has become widespread and dominant very rapidly over a period of a few weeks. The places where the variant was noted to be more prominent initially are the places where we started seeing surges early on. The second reason of concern is that this carries two mutations that are particularly concerning. One mutation is a mutation that's in the same position as the one in the so-called South Africa and so-called Manaus variants that's been associated with a degree of vaccine escape and reduced vaccine effectiveness.
They think so. So just to emphasize, there's no evidence yet that this is causing more disease severity. But if it's more transmissible, as we've seen with the other variants, then you are going to impact the number of people who go into hospital and mortality. So I was speaking to a colleague in India this morning. They are incredibly concerned about the age profile of some of the patients they're seeing in hospital. And in some of the states, the capacity, particularly for ventilation, is really being challenged at the moment. So it's just the sheer volume. So more transmissible variants mean more people become unwell, and that really challenges the healthcare system. And I think it's just a reminder to everybody in the UK that globally, this pandemic is actually accelerating in some countries while we're here easing restrictions. So very much a cautionary tale, as I said.
While the world understood to where we went wrong, why can't we?
Yet there is still no national lockdown, and public health experts have criticised the government for allowing events like a major Hindu festival to go ahead.
All possible super spreader events, including large gatherings, indoor or outdoor, should have been avoided. But whether it was elections to the local bodies or to the assemblies or the melas, the religious gatherings, and of course, large-scale celebration of social events like weddings and so on, all of them have compounded the problem.
Don't you think it's high time that the authorities and the government accept their mistake and own up to everything? And अब phase 7 में आके जब लोगों को समझ आ रहा है that rallies should have been avoided, and don't you think it's way too late now? And it's not just the people in our country who are suffering, but बाहर के देशों के भी बहुत से लोग अपनी प्रॉब्लम से लड़ रहे हैं. Please have a look at this specific video.
Those with friends and relatives in India are anxious.
Hi, Mummy.
Ash is a student. His mum back home has been seriously ill with COVID for more than a week.
How are you feeling now?
Better. Before 7 days, better.
When she told him a few days ago that she feared for her life, his instinct was to fly home. But he can't because India's about to go on the red list.
It has been getting worse and worse. And knowing that she's sick and seeing that there's an oxygen shortage, there is a remdesivir, which is steroidal drug shortage. And I was like, if she gets worse, what's next? How will she get help?
जहां एक तरफ इंडिया के कोविड के केसेस कम होने का नाम ही नहीं ले रहे हैं एंड द केसेस आर शार्पली इंक्रीजिंग, वहीं अगर हम दूसरी कंट्रीज के स्ट्रेन के बारे में बात करें लाइक द साउथ अफ्रीकन वन, तो द डॉक्टर्स एंड द फ्रंट लाइन वर्कर्स ऑफ देयर कंट्री वर एक्चुअली ब्रेसिंग देमसेल्व्स फॉर द वर्स्ट टू कम. as a new variant emerged in their country in the starting of the year in 2021. And actually हर एक 3 टेस्ट में वहां पे जब वो कोविड टेस्ट करवा रहे थे तो एक पॉजिटिव केस उन तीनों में से एक पॉजिटिव आ रहा था. बट नाउ द एक्टिव केसेस इन साउथ अफ्रीका हैव ड्रॉप बाय 90% जस्ट इन 3 months. एंड इफ यू सी द ग्राफ देन यू कैन सी कि जहां मिड जनवरी में द केसेस वर अबाउट 22,000 and now per day, and now when you see it right now, they're actually coming out to be 1,000 cases per day. And actually अगर हम 19th April की बात करें तो 744 cases are coming on a daily basis, which is like decline to some other level. And let me tell you, it's not because of a vaccine drive, and the reason of such a decline in the cases is actually a mystery for everyone. But some scientists said कि the section of the population एक ऐसे level of immunity तक पहुंच गया है जहां पे it's becoming harder for the virus to jump in and could not spread, like make its effort to that level. But this mystery actually continues. वह अगर हम बात करें ब्रिटिश प्राइम मिनिस्टर बोरिस जॉनसन की, देन लॉकडाउन की ही वजह से द कोविड केसेस में डिक्लाइन आ चुका है अकॉर्डिंग टू हिम. एंड इट्स एक्चुअली नॉट द वैक्सीन रोल आउट. उनके अकॉर्डिंग एक लॉकडाउन ही था विच सक्सीडेड इन डेवलपिंग ग्रेट रिजल्ट. हाँ, वैक्सीनेशन प्रोग्राम डिड हेल्प अ लॉट, but the major thing according to him was done by the lockdown restrictions imposed. Please have a look at the statement given by him to Sky News.
But it is very, very important for everybody to understand that the reduction in these numbers, in hospitalizations and in deaths and in infections, has not been achieved by the vaccination program. People don't, I think, appreciate that it's the lockdown that has been overwhelmingly important in delivering this improvement in the pandemic and in the figures that we're seeing. And so, yes, of course, the vaccination program has helped, but the bulk of the work in reducing the disease has been done by the lockdown.
So if you look at the data, 8 Jan 2021 तक UK में 68,000 से ज्यादा केसेस आ रहे थे, but after the proper lockdown and everything, अब वहां पे अभी भी the cases are coming, but comparatively very low, and there are about 2,600 cases that are coming on a daily basis. Well, अगर आप UK की आज की situation भी देखें, then it has been seen that the cases are declining and COVID cases have seen a downfall, but still they have imposed a lockdown and the restrictions are still going on. Like abhi bhi only 50% of the people are allowed to travel in the metro, and working class with proper IDs are traveling, and flight restrictions to lagi hui hai, like we all know. So if they are so quick to take up steps, why can't we? From the situation of a country last year to the emergence of new variants internationally and in other countries as well, to the emergence of the double mutant, the world's take on India, and हम actually कहाँ lag कर रहे हैं, and finally how the other countries cope up with this deadly virus and the new variants that are coming, and how they have seen a decline. We have covered it all. Hope you liked today's segment. If you like my video, then do like, share and subscribe to DNP India. You can also follow us on Twitter, Facebook and Instagram. Keep watching DNP India.